This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. We're at Aurora Health Center in Oshkosh and we're heading over to the allergy department. We're going to be discussing cutting-edge management for allergic patients with Dr. Anita Gheller-Rigoni. Well, thank you for joining us today. Why don't we start out by talking about some of the conditions you do treat here?
Sure. Well, most people think of allergists, they think of we treat allergic rhinitis or nasal allergies, otherwise called hay fever, and we also treat food allergies. And one thing that often is not related, or people don't relate to an allergist, is asthma. We treat and help diagnose asthma, as well as eczema, which is dry, itchy skin. And lastly, something called vocal cord dysfunction. This is something which can present like asthma with wheezing and shortness of breath, but they often also have chest tightness or throat tightness and don't respond to normal asthma medications. And I can both see the patient in the clinic, I get a good history, and then I have diagnostic testing for vocal cord dysfunction. And we work with our speech therapy center here, who helps to treat the individual after I make that diagnosis.
Do you see specific types of allergies or problems during the winter months?
Yes, winter, because we spend more time indoors. Things like mold, dust mite, animal dander, those are much more commonly encountered in the higher levels in the home during the winter months, mainly because we're indoors more. We do have ways to help people to decrease those levels in the home. For example, my biggest, I don't want to call it a pet peeve, but people say they're allergy-free animals. There's no such thing as an allergy-free animal. We're allergic to the dander, or the skin they shed, as well as the saliva and the urine. So it doesn't matter if they're shedding, non-shedding, hair versus fur. All pets, dogs, cats, carry those allergens. And so if you're allergic to them, those levels also, because we spend more time indoors in the winter, can be more irritating. And then with Christmas trees or the mold on the branches, people think, oh, I'm allergic to the pine. It's actually often the mold that collects on the needles that we're allergic to. And there's other things you can do for indoor allergens like dust mite and mold. Well, keeping the humidity low, which usually isn't too much of an issue in the winter, keep it below 50%. Removing any visible mold from the home with a bleach solution is helpful, so if there's any of those black spots or areas where you can see the mold. And then for dust mites, washing bedding in hot water and just keeping things clean is helpful.
Sure. And I would imagine food allergies are also a problem for some people. Do you have tests that are unique from other clinics?
Yes, we do the usual testing, such as the skin testing, the blood testing, which most allergists use, but one service we do offer is a food challenge. So once an individual gets to a point in their life where we think they may have outgrown their food allergy, for example, 80% of kids will outgrow an egg and or a milk allergy, whereas only 10 to 20% will outgrow a tree nut or a peanut allergy. So we can bring them into the clinic if we think it's safe now at that point in time, and then we'll do what's called a food challenge, where we give them tiny doses over time. And this service is a bit time intensive, but in the end they're able to know if they can or can't safely consume that food. So we're able to help people in that way.
And some people deal with eczema. Now, is that something that you can help people with in the allergy department?
Yes, and often about a third or more cases of eczema are related to an environmental or a food allergy. And we do teaching here for skin care, as well as the testing to see if there is a food or an environmental allergen contributing. And then I offer a lot of tips at home to help manage the skin. It's actually, once patients understand how to manage it and what's causing it, we get much better control of the skin. And it's a real problem for children as well as adults, because it's the itchy, dry, red skin, and it tends to get worse in the winter months because it's so dry.
You guys are very busy in this allergy department. You can also help people with asthma as well, right?
Yes, and we have 2 nurses here who do a lot of the educating for our asthma patients. And one of the strong beliefs I have is they need to be educated. what is asthma? Why do I have it? How do I properly use my inhalers? If I don't have somebody on the proper inhaler for them, or if they're not able to do that technique properly, then their asthma is never going to get better.
All right, so we're talking about asthma, eczema, allergies. Are there other things that you can help people with besides just medication that can help them with these problems?
Yes, one of my favorite things that I utilize is something called the nasal saline rinses. So this is something that's not a medication, almost free, and they can rinse their sinuses. It helps rinse out the allergen as well as the mucus from their nose, and they can use it in conjunction with medications. But if we reach the point where medications are no longer helpful, then I offer allergy injections or allergy shots, people call them. Again, this is something a little more time intensive, but in the long run helps their immune system develop from something that's allergic to something that's non-allergic, in the end requiring less and in some cases no medications. And interestingly, in the childhood population, there have been very nice studies looking at preventing allergies and asthma in people who receive allergy injections, so preventing the development of new allergies.
And a lot of that takes on the education part of this department as well. It's not
Yes.
just treating the problems, it's educating people to those problems as
And
well.
helping to prevent more further disease.
Absolutely. Now, does a person need to be referred to the allergy department, or can they just refer themselves?
Some of this is dictated by the patient's insurance, so some insurance policies require referral. But there are individuals out there who have been suffering from either hay fever or asthma, or they have obvious symptoms, and they've used all of the over-the-counter medications, and they're not better. And certainly I'm happy to help those individuals without them requiring a referral.
Okay, there's no reason to suffer. You should get over here and see you in the allergy department.
That's correct.
All right, well, thank you for joining us today.
Sure, thank you.
For more information or to schedule an appointment with Dr. Gheller-Rigoni, you can call Aurora Health Center in Oshkosh at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Health Care.